Diaries of a Healthcare Activist, March 2018. When I was brought on board to SET, I was tasked with creating the UGIS program in SRHR. 7 months later, I'm proud to say that it has officially kicked off. We have our regional youth hubs in countries, but also I'm standing in Johannesburg, South Africa at the launch of our inaugural leadership training. The European Union Young Leaders Program, it was engaging high-level policy makers. And then, of course, from One Young World, it's trying to think about creating a leadership program that really gets one to think out of the box, to push change, to really be that different and real leader. So picking on these different elements is how I came about to develop this leadership program, but also a youth quake, which is primarily behind the program as well. So what is meant by a youth quake? Just around December last year, if I'm not mistaken, the term youthquake was adopted by the Oxford Dictionary, and it actually means a powerful movement of young people bringing change. So we incorporated the idea of a youthquake into the training and into sexual and reproductive health, but also gender equality, in terms of there's been so much being done already. So if we look at HIV, millions have been poured in, but the situation has not changed. When we look at gender equality, the structural causes, patriarchy, male domination, they still exist. So the idea of a youthquake is, how do you embolden young leaders? How do you allow them to achieve that causal pathway to success, to change the landscape, to, as one of my colleagues say, to create an earthquake in SRHR. So hopefully this is the beginning of a game changer. It's the beginning of a volcano, it's a beginning of an eruption, but also massive change which is to come.